I would first bring the consultant and the expert to bear on. It's a very broad topic, right, Aryaman? But maybe you could just tell us a little bit about where do you see the challenges? You know, we've heard a lot about supply side challenges, scale challenges, but taking this composition and this subject in mind of specialized chains and how they cater to Indian healthcare, what are the possibilities and what are the issues that you see?
Thanks, Lokesh, and also thank you for the Mint team for hosting such an exciting session. Of course, the question is pretty broad-ended, so I'll try and keep it as succinct as possible. See, in my mind, there are 4 or 5 things. The long list is pretty long. What matters is what are the 5 big needle movers in this. Biggest challenges from the single specialty care. The number 1 is insurance. I know we've spoken a lot about insurance in the previous sessions, but I have 2-3 slightly different points to make about insurance. Number 1, insurance in India, health insurance is a very dumbbell-shaped market, where on the lower end, with Ayushman Bharat, with CGHS, CSI, etc., you already reached a good insurance level, where the per capita coverage is close to almost $1,000 per year. The higher income people already have very high penetration of private insurance and group insurance through companies. The issue is the missing middle, which is mostly there in the urban areas, the middle to lower middle income people. Close to about 300 million people, in the urban India are uninsured. And these are the people who actually need insurance. The other thing is the coverage of insurance around wellness, coverage of insurance around other areas like our own Ayurvedic treatment methods, dental, etc. A lot of other categories and specialities which are not covered in insurance. And also finally, the amount of coverage that is actually given to these lower income and middle income people in urban India is abysmally low. It is close to about $400, $450, which is even lower than the coverage which is given to lower income people through the government schemes. And these are actually the people who are going to these single specialty chains in tier 1 and 2 and 3 cities and needing care. Because the higher income people are already going, to the corporate chains. And another thing about insurance is, see, we can talk about causality or, correlation, but insurance is also a little bit a double-edged sword. Today in US, with a very high insurance coverage, out-of-pocket treatment has become completely unaffordable, right? So we also need to drive insurance in such a way that out-pocket also remains affordable, in any kind of hospital that you're able to go to. So that's one. Number 2 is the supply of hospital beds. So we do a lot of work in this area, and actually our point of view is there are close to about 2.7 to 2.8 million hospital beds in India, combining public and private both as of now. This number has gone up. A lot of the estimates that you see publicly available are actually older estimates. They don't cover what's happened in the last 3 to 4 years. Especially in the single specialty, mid-sized chains, a lot of supply has come in the last, close to 5 years. So we're at about 1.6, 1.7 beds per 1,000 people. WHO recommends, of course, a much higher number. A lot of developed markets are there close to 2 to 3, 2.5. US hovers around that. So we are actually, of course, short, but we've covered a lot of ground in the last sort of 5 to 10 years. What is the issue? 3 things. 1, supply is there where demand is low, and supply is not there where demand is there. Tier 2 cities, tier 3 cities are growing demand close to about 10% volume year on year, but supply is not growing at that rate. So that is 1. 2 is less than 1% of hospitals are actually accredited. So there's a massive shortage of quality beds. Though there are 2.8 million beds, our estimate is less than 25% are high quality, right? And the third thing is, in all these hospitals, majority, about 75% of the supply are small to medium-sized hospitals, which actually lack a multi-speciality or a full-stack care view, right? That's 2. So the whole supply bit, again, is a big shortage. The third thing is testing, and Dr. Manchanda, you'll speak a lot about it. But we do roughly 1 test per capita in India per year. This number is 10 times 1/10 of the number which is there in a lot of other international markets, developed or even some developing markets, which basically means, and we do about 3 to 4 consults per person per year. So less than 30% of consultations are actually being giving out without a testing, which basically means the whole clinical outcomes, the treatment protocols recommended, are they even right? The medicines recommended. The fourth is, a lot of, when you talk about single specialty, right, a lot of the capex and a lot of the medical equipment which is actually being bought, about 70% of it is imported, right, which basically leads to a much higher cost of care. And finally, what I would say is, and this is probably a more mother-all statement, but I read this interesting research where if you look at the average life expectancy of in India is about 68, 70, it's of course in the 80s. If you go to developing markets, the early years of life, economy is created by consumption. The later of years of life, the economy is, created by spend on illness, right? If the life expectancy and wellness, preventive care, health is addressed early on, and the incremental 10 years of life that you get, the overall economic impact of that is going to be about 20-25% higher, right? So that's why the focus on preventive care, wellness, general integrated care before people actually get sick, and how that gets integrated into insurance, also becomes a very important part. So I think those are 5-6 biggest challenges. Also, I'm a firm believer that whatever is a challenge is at the end a big opportunity in this space, are also big opportunities, right?
So how do you use technology to scale to the maximum possible?
Yeah. I think, if we talk about technology, and if we talk, let's say, about a single specialty chain or any delivery setup, I think there are 4 or 5 aspects which we need to look at. One is the patient side, other is the supply side, third is the whole ops and the patient experience, fourth is the clinical side of technology, which is deep on the whole operating system and the doctor training, right, and the protocols, etc. And finally, there's also a big implication on that financially, right? So if we talk about, let's say, on the patient side, right, there is so much technology innovation, and I personally feel that we've only scraped the surface right now in terms of what all technology that exists. Right from managing patient records, companies like, for example, Fortis, every year creates about 20 million patient records, right? Imagine the amount of analytics, treatment protocols, drug effectiveness that can be tested basis that. That is one. Two is the whole medium of delivery of care, which Dr. Manchanda, of course, spoke about. Teleconsult today, interestingly, has become more expensive, than a in-person consult. It is quite counterintuitive. You know why? But I think the way doctors perceive is that that's an incremental service that's been given to a patient, because you don't need to walk to a clinic and get a consultation done, so the patient should be paying for it. So it's actually become more expensive, right, than an in-person consult, right? Chronic care, by the way, the amount of technology, and we saw in the previous panel where Beto, etc., and a lot of these chronic care companies have set up. I think chronic care is not just a business model, but it's a theme, which impacts everyone. All delivery, single specialty, multi-speciality. How can you embed, making sure that the testing is happening on time, making sure that the patients see the records, you integrate that with wellness. There's so much smartwatches, etc. We've seen 2,000, 3,000 crore companies set up in a matter of 2 to 3 years, with this fitness, wearables, etc. That's a big booming space. The amount of data that's available beyond the hospital, and any healthcare setup which is available to a delivery provider is massive. And using that to create care on the patient experience side. Today, if you go to a lot of hospitals, very few hospitals actually have an omni-channel play. You still need to stand in a queue to make a payment, even if you're having a big pain, right, in your stomach, right? You can't pay online and just quickly go and consult a doctor. Very basic things. I don't think we need to do magical stuff on the patient side. Very basic things, if we're able to solve, there's massive opportunity we can create. Then on the clinical, right, if we talk about any single specialty care, right, at eye care, for example, there are 3 or 4 major types of procedures, right? And one procedure is about 80%, 70, 80% of the volume. The amount of standardization of protocols that you could do, training of doctors on the clinical side, you can actually reduce the cost of care because you can bring in younger doctors and train them quickly using digital so that they're able to deliver treatment much more effectively. You've seen technologies like Cure, etc. They've raised a lot of capital which enable. I don't think you need to supplement the provider. You need to replace the provider. You need to supplement the care provider so that they get technology and they get more productive, right? At the end you do. I don't think AI, at least right now, can completely replace, right? Then on the ops side, procurement. We've seen players like tech players like Medica, etc., all of it, which they've done. And there's massive amount of technology that can be embedded, technology providers embedded into your system. And finally, I would say, recently there's this, forgetting the name of the company, this AI-based HMS, provider which raised about 15, 20 million capital. AI, etc., is creating a lot of productivity improvement in all spheres of businesses. And finally, the last leg of technology and digital is business models. Today, if we look at a Fortis, for example, or Max or Apollo, Fortis itself has about 20 million patients a year, including their diagnostic business. Their presence in about 500 plus cities, the network of hospitals. The amount of assets and the amount of new business models that can be unlocked using digital, is massive right now. So it's not just about patient side, it's about new business models. It's about how to run ops more effectively and how to create better patient experience and clinical outcomes. These 4 buckets of work where digital actually creates impact.
Wonderful, thank you.